Hello everyone, this is the last part of Unit 10 UGC NET GRF Forensic Science. In this part we will discuss about skull superimposition, facial reconstruction, human dentition and forensic entomology. The distance between the two pupils of a person never changes throughout his or her lifetime. So based on these characteristics, we can superimposition technique is based. So in this technique, two negatives are superimposed or kept over one another, and various points are compared, such as canthus, nasion, nasal spine, lower border of nose, upper jaw, supraorbital ridges, etc. And these points are compared and photographed to analyze for the similarities and dissimilarities between the two negatives, and then a conclusion is drawn. In another technique, that is facial reconstruction, surface scanners are available that includes laser, photographic projection, holographic processes, 3D models, etc. These are created and imported into computer based reconstruction system, and a 3D replica is formed. The various types of superimposition techniques involves flicker and change detection. In flicker, both the images superimposed and then non-superimposed, again superimposed, non-superimposed rapidly to estimate the similarities and differences. In the change detection method, the computer will only show the differences between the two pictures and highlight them with different colors. In wiping technique, one of the two picture is wiped over another one slowly so that the similarities and differences can be observed. In the matching technique, the left half of one picture is placed over the right half of another picture and they are compared. Bertillon system or anthropometry, it is based on Quetelet's law, that is other than after growth, after birth, when the growth is very rapid, or puberty. Other than these conditions, the weight of a person increases as the square of its height. It is also termed as body mass index by Ainsel's Keys. The Bertillon system consists of 11 body measurements. Forensic odontology is the study of teeth. It also involves the study of chyloscopy, that is the study of lips or lip prints, the study of bite marks, rugoscopy, palatal prints, etc. And Dr. Oscar Amido is known as the father of forensic odontology. Palatal prints are unique and can be used for identification purposes, was suggested by Harrison Allen. The adult teeth comprises of 32 teeth, with each teeth having 5 surfaces, and for identification purposes we have to observe the various things that are missing tooth, filling material, carious lesions, crowns and prosthesis or artificial teeth. So there will be a total 160 surfaces of the teeth, and all these things form the basis of dental identification. Additional features include root canals, periapical and surrounding soft tissues, etc. Jacobson and Kaiser Nelson set up 3 criteria before bite marks comparison. So first is the marks should be, whether the marks are made by human teeth or not. The amount of skin in the bite mark will determine the shape of the mark. Second is the reliable impression production, or the photographs should be clear and reliable. Third is the circumstances under which the bite was inflicted. Then ellipsoid shape indicates small amount of tissue was taken during the bite mark and only anterior teeth are involved. Animal bite and their characteristics: dog bite, circular arc; cat bite, small rounded arc with punctures; rodent bite, long grooves; shark bite, well defined margins. Other factors for dental identification: so the number of teeth in up to 3 years of age, they 3 to 6 have 20 teeth, because there is temporary dentation. From 6 to 11 there will be mixed dentation, so 24 teeth will be observed. Tooth loss, so whether it is antemortem tooth loss or postmortem tooth loss. So in antemortem loss, the healing is observed in the surrounding area. So this is how we can differentiate post-mortem tooth loss and antemortem tooth loss. Then there is restoration. The restoration on the anterior teeth involve 4 surfaces: mesial, distal, labial and lingual. And posterior teeth involves 5 surfaces: buccal, lingual, mesial, distal and occlusal. We should also look for the type of filling material used. It can be silver amalgam or tooth colored material, etc. The metal or non-metals, the metals used: crowns of coal, gold, porcelain, etc. Temporary dressing or fillings, that is zinc oxide, eugenol, can be used. So for all these purposes dental radiography is done. Dental prosthesis, artificial teeth. Bony pattern, so the medullary bone of the jaw possesses a characteristic pattern, and the things to be observed are tooth angulation, root morphology, bone loss, changes in the pulp, etc. Examination of alveolar bone indicates the predental diseases. Oral pathology is the estimation of time by the presence of healing fractures. So we estimate the time of the injury using these healing fractures. Occlusion and malocclusion is the position of the jaws, so whether it is normal when the mouth is closed or it is misplaced. Occupation, habits and social status also contributes for dental identification in occupations such as peeling of wires, or habits such as tobacco eating, etc. All these affect the human dentition. Prognathism is the extension or bulging out of lower jaw. Macrognathia is abnormally large jaw. In Parkman-Webster case, body was identified using jaw bones and dental structures, and the space between the two teeth is known as diastema. And Hutchinson teeth are teeth having teeth which are small but the space between them is very wide. Anatomy of tooth, so it consists of 2 parts mainly: the crown and the root. In between there is a neck. So the crown is the visible part and the neck is the hidden part. The root is the hidden part. Root is also known as acrodont. The outermost portion of root is known as cementum, and dentine and pulp tissue form other 2 layers of the root. Most of the tooth is made up of dentine, and pulp tissue is used to supply the blood to the tooth, and the crown is covered by the hardest substance in the body, that is enamel. striae of Redzis are the incremental lines developed during the crown formation. Lines of Owen are the occupational prominent growth lines in the dentin of the tooth. The gingival fibers hold the gum tissue firmly against the teeth, and it consists of two types, type 1 collagen and type 3 fibers. Both are involved in this process. Hunter-Schreger bands are identifying features of enamel of mammal teeth, mostly placental mammal teeth. So these are used to strengthen the enamel. The deciduous dentition or the temporary teeth begin to develop during 6th week of intrauterine life, followed by mineralization. Mineralization begins at 14 plus minus 2 weeks and it continues after birth. Then the permanent dentition begins to calcify after birth. Firstly, the molar will be erupted and then it is completed by the age of 15 plus minus 1 year. Neonatal lines are the stress lines formed during childbirth. Sharpes fiber, bone fiber or perforating fiber, these fibers join ligament in holding a tooth onto its socket. These fibers are present in cementum. Haderup system is a European system for identification of teeth using number of each permanent tooth along with plus or minus sign to indicate the tooth position. Plus means for upper midline tooth and the minus means for the lower midline tooth. Dental age estimation. First is Atlas approach or radiography. So the tooth mineralization stages are less affected by any variation. So these can provide accurate indication of the chronological age. Shore and Messler describe 20 chronological stages of dental development from 4 months of 4-month aged baby to 21 years of aged adult. So the age can be estimated from this table. Demergent technique, in which there is 8-stage scale A to H to identify the dental maturity score, and then this dental maturity score is converted into dental age using the standards. Dental age estimation in adults. So Gustafsson method, in which 6 dental changes are observed. First is attrition, in which gradually with the age the tooth is affected. So first the enamel will be worn out, then dentin and then the pulp. Second is periodontosis, in which firstly there will be recession in the gums and the surrounding periodontal tissues with respect to the age. Secondary dentin. So secondary dentin develops within the walls of the pulp cavity, and due to this development the size of the pulp cavity got decreased. So it can be due to aging or any other conditions, disease. Cementum apposition, in which the age can be estimated by counting the incremental lines of the cementum. Root resorption, usually found in adults, old age people. So the cementum and dentin show characteristically sharp grooves. The last one is the transparency of the root. So with age the dentinal tubules are filled with mineral and turn opaque. amino acid racemization. So as the development, as the age advances, the L-aspartic acid will change into D-aspartic acid. Ethanol, formalin, formaldehyde, all these are used as fixative for dental age estimation. And during dental age estimation, the adherent tissue is removed from the teeth using sodium hypochlorite, and the tooth samples were washed with the acetone, then by 0.2 normal hydrochloric acid. Proteins are extracted using EDTA, and demineralization is done using HCl or EDTA, and the analysis of tooth will be done using GC. Coefficient of racemization is given by the given by this formula. Kr is equals to A into age plus BKR is equals to natural log 1 plus D by L by 1 minus D by L, where D and L are integrated peak areas of respective enantiomers, whether L-aspartic acid or D-aspartic acid. A is the rate constant of racemization, and B is the y-intercept. Now the various dental notations. Notation in Zsigmondy system, it is done by Roman numbers up to 5, that is 5 4 3 2 1 1 2 3 4 5. Palmer system uses alphabets E to A, then A to E. In Cunningham notation, it again the alphabets are used, but A to J for the upper mandible and T to K for the lower ones. FDI notation is given by numbers, numerical figures, numerical numbers. Now the Tsukiji classification of lips. Type 1 shows clear cut groove running vertically across the lip. Type 2 is Y and inverted Y-like bifurcations. Type 3 involves X-shaped grooves. Type 4 involves grooves, reticulate grooves. Reticulate network-like. Forensic entomology is the study of insects who feed on the decaying remains. So these includes flies, beetles, ants. So flies are the first one to get attracted towards the corpse or the dead body. Carrion flies includes Californidae or blowflies, Sarcophagidae or flesh flies, and Muscidae or house flies, and they belong to the order Diptera. Beetles are found in old cadavers or the bodies in the dry conditions. So they include Sylphidae, carrion beetles, Staphylinnidae, rove beetles, and dermestids, carpet beetles, and they belong to the order Coleoptera. Beetle larva is known as grubs. Ants generally consume smaller cadavers, and they belong to the order Hymenoptera. The life cycle of blowfly. So the life cycle of blowfly consists of egg, larva, pupa, and nymph. This is known as the complete metamorphic cycle. First, the adult fly will lay eggs on the area surrounded the wound or around the openings of the body, mouth, nose, etc. Second, the egg will hatch into larvae or maggots within the duration of 12 to 24 hours. Third, the larva will continue to grow by getting their nutrition from the dead body and shed their exoskeleton, and will transfer into the instar stage. First instar stage is 5 mm long and it will be observed after 1.8 days. Second instart stage is 10 millimeter long and it will be observed after 2.5 days. The third instart stage is 14 to 16 millimeter long and it is observed after 4 to 5 days. Fourth, the larva, that is 17 millimeter long. Then the larva is converted into the pupa. Fifth, the adult fly emerges from the pupa after 6 to 8 days. So this life cycle of blowfly will help in estimating the time since death. The factors affecting insect growth are: first, the temperature. The higher the temperature, faster will be the growth of the insect and it will develop into an adult faster. The life cycle would be short. Food quality. Rich, nutritious food will help the larvae to grow faster. Oxygen level. So increase in oxygen concentration increases growth rate. Day length or season. There will be seasonal variation in the life cycle of various insects. Time since death or faunal succession. So flies are the first one to arrive after the death. They arrive within minutes or hours after death, and then carrion beetle will arrive within few days, and carpet beetle will arrive when the corpse will be dried out. The various factors affecting insect colonization are weather, temperature, burial or exposure, and location. Weather. So when it's raining, insects are less active, so colonization will be slow. Temperature. If the temperature is low, insects are less active. Burial or exposure. Buried corpse would decompose slowly. Location. Bodies in dry environment will desiccate before insect colonization, and body in wet places will attract many insects. So this is how forensic entomology helps in estimating the time since death. All the best for your exam. Stay tuned for videos on previous year's question papers. Like, share and subscribe my YouTube channel Vidhi Vigyan. Thank you.